Just like Mark, I only have a few slides here to show about Kawasaki. And I showed the kind of what you were just saying about the fact that we do have, very specific guidelines about Kawasaki. There was an endorsed clinical report from the American Academy of Pediatrics and the American Heart Association that had very clear guidelines. And one of the guidelines was that if you have coronary aneurysms, you should have cardiac catheterization performed at 6 to 12 months or sooner if clinically indicated after you're initially diagnosed. And the reason you do that is to look to see how severe the aneurysms and the stenosis that occurs with the aneurysm can be seen. And my question to you as well as to the rest is, why not do an MRI or an MRA to look at these coronaries? And the reason to do that would be because it can give you even more information. So here's catheterization on the left. Then you see the non-contrast MRA here, and then the MRA with reconstruction. And I think that you would agree that the coronary arteries are shown very well and very similarly to what you see in the cardiac catheterization. We could look at the ejection fraction on these patients by cardiac MRI. You could see this patient very clearly has decreased ejection fraction and very specific regional wall motion abnormalities right around in this region, all around across here, with poor contractility. And then when you look at the delayed enhancement of that same patient, you could see he's had a myocardial infarction all across through here, here as well, and here as well. And so when you look at his coronary arteries, you can see the giant aneurysms that are present here on the left coronary artery, as well as on his right coronary artery. You can see this again with other patients. Here's another enlarged coronary artery abnormality. So I just wanted to briefly mention to you guys, cardiac MRI for looking at the coronary artery abnormalities and really looking at it. Distal can be really nice when you have difficulty looking at it by echo. You get the function, and then you get also to look to see if there's actual ischemia that has occurred and has caused myocardial fibrosis. That's it. So with the Siemens magnet, we don't have a problem with heart rate. I know the GE magnet needs it to be under 120 beats, which is still pretty fast. But if you have a 6-month-old, you can easily get them over 120 and have to slow them down. But with the Siemens, luckily, I can get higher heart rates. The other thing is that I use a special contrast agent called Ablavar, which is a contrast agent that remains in the intravascular space and does not go into the tissue. Now, when you use that, you can't look at the myocardial fibrosis, but it does allow you to look at the coronaries much more clearly. So, what was your experience? Did you have a hard time with the heart rate?
And usually we wanted to have it below 100, so we would occasionally use a beta blocker.
Like a short-acting